Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is February the 3rd. It is week 48 here in Montgomery County of the COVID-19 pandemic. And today I'm joined by my colleague, Commissioner Ken Lawrence. Today I'm going to begin with the latest vaccine updates for Montgomery County. The vaccine situation is changing on a daily basis, and I want to ask our community's ongoing patience and understanding during this evolving situation. The Pennsylvania Department of Health changes to the vaccine eligibility announced 2 weeks ago dramatically expanded the eligible group of recipients. However, there has been no comparable increase in the amount of vaccine that we are receiving. In fact, the Montgomery County Office of Public Health received 3,500 fewer first doses this week than last week. As a reminder, 2 weeks ago, the Pennsylvania Department of Health issued new guidelines for the Phase 1A group, people ages 65 and older, and people ages 16 to 64 with specific underlying medical conditions known to be associated with severe cases of COVID-19 are all now considered part of the 1A group. Montgomery County receives its vaccine from the Pennsylvania Department of Health and thus are required to comply with the newly released guidelines for 1A. With these expanded definitions for the 1A group, we estimate approximately 230 to 250,000 additional people qualify for vaccination in Montgomery County as part of 1A. We do have the infrastructure in place to administer a lot of vaccine each day. We just need more vaccine. For now, anyone 65 and older and those aged 16 to 64 with specific underlying medical conditions are encouraged to pre-register to receive the vaccine from the Montgomery County Office of Public Health on our website at montcopa.org/COVID-19 and click on the vaccine information button at the top of that page. For those of you that have already pre-registered on our site, we are working to communicate with you more regularly in order to give you information about where you are in the line of registrants. As of 9:30 this morning, we have 139,926 people pre-registered. At this time, and depending upon when you registered, it may be up to 12 weeks before you hear back from us about scheduling an appointment. We do now have information on our website to give those of you who have pre-registered some idea of where you are in the line. On our vaccine page, there is now a link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th. If you know the date you registered, you can see how many people are ahead of you. We will soon be adding a running total of how many doses of vaccine we have received and how many doses we have given, similar to what we present at this briefing. Again, to get to that vaccine page, go to montcopa.org/COVID-19 and click on the vaccine information button at the top of that page. We've received a number of questions about this entire process that we're going to go through today, and hopefully we'll be able to answer a lot of those questions. So the first is, what happens after you pre-register? Once you submit your pre-registration, within 10 minutes, you will receive an email from our survey provider, VOC, under the name Montco COVID Vaccine at noreply@voc.com. And that's the first email that you see on the graphic in front of you. This will confirm that your registration has been received. If you don't receive a confirmation email, please check your spam folder. Then, when we have vaccine for you, you will receive an email from one of two possibilities. The first is public health at montcopa.org or from Jay Panning at montcopa.org with a link to a system called PrepMod. It is through PrepMod that you will make your appointment. This system links to the Pennsylvania Department of Health and allows us to complete the mandated reporting that you have received a vaccine. The PrepMod portal requires that you submit additional personal information. We are aware that you have to complete the personal information before being able to select an appointment time, and that if all of the appointments are taken, you have to start over and resubmit your personal information before you can choose a different time. We have asked Pennsylvania Department of Health to change this so that you can choose an appointment first, make sure you have that time slot, then enter your information. We have not yet heard back if this change can be implemented. Finally, once you have scheduled, you will receive a confirmation of your vaccine appointment from PrepMod. The email comes from vaccination clinics with an email address that's listed on the slide in front of you. It says no reply at multistatep4p.com. If you're having trouble getting the initial, that very first confirmation email that you were pre-registered, first, please check your spam folder and also make sure that you actually hit submit on your form. If you still not received that confirmation, please check to make sure that you hit that submit form, and remember that we're only taking pre-registrations for people eligible for the phase 1A at this time. If you're eligible for phase 1A and you are sure that you've submitted that pre-registration survey, you hit the submit button, then go ahead and send an email to Montco COVID vaccine at montcopa.org with incorrect email in the subject line. And you can see that, information there on the slide before you. In that email, make sure to include your name and your correct email address. If you had not received the email, most likely it's because you made an error in submitting your email address. I've also been asked why the county is only making appointments for a few days at a time when other places are making appointments for many weeks into the future. We do this because we do not have any certainty about how much vaccine we're going to receive each week until the vaccine actually arrives. We don't want to have to cancel anyone's appointment. If you do receive an appointment through the county, barring some unexpected catastrophe, we will have a dose of vaccine for you. This week is a perfect example of the supply challenge that we are dealing with. We were told yesterday that we would receive a delivery of vaccine today, but we were not told how many doses would be in that delivery. Today, we learned that we are receiving only 1,000 first doses. This will allow our clinic to operate through next Monday, and that's only because we have vaccine from Monday and Tuesday's clinics, which had to be canceled. So we will have enough to operate through next Monday. If we don't receive more in time for Tuesday, our Tuesday clinic, we will not be able to offer vaccinations on that day or until we receive additional first doses. The good news, the one bright spot here, is that we did receive our requested second doses for this week. So if you're expecting a second dose this week, we have vaccine for you. I want to remind everyone that wherever you receive your first dose of vaccine is where you need to go to get your second dose. Please, please do not forward appointment links to family and friends. If you receive an appointment link, that link is only meant for you based on your eligibility and whether it is your first or second dose. People are taking these links and posting them on social media, and this creates the opportunity for people to jump the line and for people who are not eligible to register. This is not ethical or moral, and it needs to stop. Given the scarcity of the vaccine, we need to pull together as a community and make sure that our most vulnerable get vaccinated first. There will be enough vaccine for all of us that want it, but there is not enough today. Because of the scarcity of the vaccine, you will be turned away at the vaccination site if you are not in the eligible group. We opened the Montgomery County Community College mass vaccination site 28 days ago on Wednesday, January the 6th. Starting today, Wednesday, February the 3rd, the community college will only be open to individuals returning for their second dose. This afternoon, we will open a new mass vaccination site at Norristown High School for everyone getting a first dose. Any first dose appointments beginning today, February the 3rd, will be for the Norristown High School site. Individuals cannot choose their location. I do want to note that the Norristown High School site has much easier access for seniors than the community college location does. I want to thank the Norristown Area School Board, led by President Shay Ash, and Norristown Area Superintendent, our school district superintendent, Christopher Dormer, for their support and partnership in making the high school available to the county. I am very encouraged by the enthusiasm that so many individuals have to be vaccinated, and I continue to ask for your patience. I want to share a graphic with you to give you a sense of where we are in this process. Sadly, this graphic does not look a whole lot different than it did last week because we had to cancel our vaccination clinics Monday and Tuesday. Now, those individuals are all rescheduled for tomorrow and Friday, but then we only got the 1,000 doses today. So far we have received at our County Office of Public Health 22,500 first doses, and we've administered 18,870. So that leaves us with 3,630 remaining. We're going to use about 300 of those doses, or actually, I'm sorry, about 400 doses this afternoon, and then 1,000 tomorrow, 1,000 Friday, 1,000 Monday. So you can see by the end of the day, Monday, we will get a vaccine almost completely. So it's going to be a very challenging situation if we don't get more vaccine either later this week or the early part of next week. In terms of our entire county, we're now estimating that we still have about, pretty close to 250,000 people remaining in that 1A group, maybe slightly less than that. And then we do still have healthcare personnel that are getting vaccinated. And so moving forward for these next few weeks, we're going to do some healthcare personnel each day and then some of the 1A group each day. So in total, where we are as a county, and so this would include pharmacies and other locations that have some vaccine. This includes individuals that have been vaccinated through the Federal Pharmacy Partnership in their long-term care facility and skilled nursing or assisted living, and some other groups like that. So as a county, we have now vaccinated partially. That means they've gotten one dose, 48,704 people, which is getting close to 6% of our population. I do have to note that at this point, we have vaccinated more individuals than have been confirmed positive with COVID-19. So we are making a little bit of progress here. And then when it comes to those that are fully covered, meaning they've gotten both of their doses, we're at 12,336 individuals. We've also received a number of questions about other locations to get vaccinated in Montgomery County, like pharmacies. I want to make it really clear that the Montgomery County Office of Public Health does not distribute vaccine to pharmacies or have any control over how pharmacies use that vaccine. The Pennsylvania Department of Health distributes vaccine directly to them. There's no centralized scheduling portal. That was a decision of the Pennsylvania Department of Health, not the counties. So you must check with each pharmacy regarding their process to make an appointment. Some doctors' offices, a tiny number, are starting to receive vaccines, so you absolutely can check with your doctor. And there's no problem with registering for vaccine at more than one location. You can get a list of those other locations that is updated by the Pennsylvania Department of Health on our COVID website at montcopa.org/COVID-19. Finally, early next week, we will open a call center for Montgomery County residents to answer questions about vaccinations. Shortly after that, we will add the ability to pre-register for vaccination by phone for those that do not have internet access or in email. Now, moving on to our regular update, during the time period of January the 27th through February the 2nd, we have 1,572 new cases of COVID-19 reported in Montgomery County. This is a daily average of 225 cases and brings us to a total of 43,220. These positive cases are a result of a positive test for the virus and not from the antibody test. 47 of these cases are from long-term care facilities, 2 are from the Montgomery County Correctional Facility, and 19 are from other congregate settings. That leaves 1,504 from our community. These positive individuals are from all 62 municipalities in the county, and you can check the geographic information at moncopa.org/COVID-19. Today's individuals range in age from 3 months old to 100 years old. There are 781 females and 781 males, 10 unknown. I am very sorry to confirm that 22 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,147 deaths confirmed positive from COVID-19. These 22 individuals ranged in age from 60 to 98 years old. 18 died in a hospital, 4 at a long-term care facility. And in terms of gender, overall, since the pandemic began, we have 592 females and 555 males who ranged in age from 25 years old to 106 years old. The self-reported or family-reported racial breakdown as we have it are 2 individuals that identify as American Indian or Alaska Native, 31 Asian, 6 Asian Indian, 5 Asian Korean, 137 African American or Black, 571 white, and 395 unknown. The situation is stable at the Montgomery County Correctional Facility. All individuals who've tested positive are in stable condition in isolation, and routine antigen testing continues for all correctional officers. On some good news, our positivity rate has continued a downward trend this week. Our 14-day average positivity rate is now 7.93% as of Thursday, January the 28th, compared with 8.53% as of Thursday, January the 21st. This is our 14-day PCR positivity rate. And just as a reminder, the orange line in the background are the number of people who were tested on that particular day. And then the blue line is the 14-day running average of positive tests. So you can see we are slowly heading downward, which is great news. As a reminder, a positivity rate below 5% is considered suppression of the virus. So this graph shows our daily positivity rates rather than an average positivity rate. And we've expanded this out now to show the last 28 days. So you can get the sense of the daily variation that we see, but also how we are steadily trending down and inching closer to that red line, which is 5%. Being under that red line is considered suppression of the virus. So I hope everybody keeps up the good work, continues to be safe, and let's continue to push that positivity down. As I mentioned earlier, our hospitalizations continue to remain high, but have improved since last Wednesday. So the good news is they continue in a steady downward trend. Today, 255 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is decreased from 289 last week. 14.5% or 37 of these individuals are requiring a ventilator. Our hospitals do remain quite busy. To put this in some context, and you can see from this chart that back on October 1st, there were only 24 patients hospitalized with COVID-19. So although these numbers are coming down, they are still quite high, and we need to be very, very careful. In terms of testing, for the 14-day period ending January the 28th, 50,120 Montgomery County residents were tested, which is a decrease of 3,888 people tested compared with the 14-day period ending January the 21st. We do want to encourage people to be tested. We have plenty of testing available. So let's take a look at that date tested graph. As a reminder, the gray vertical bars are the number of positive cases on any given day. The red is the 7-day average of total cases. That means cases from the community, long-term care facilities, and congregate cases. And the pink is the 14-day average of total cases. The dark blue is the 7-day average of cases from the community only. The light blue is the 14-day average of community-only cases. And then way down at the bottom, you can see the orange and the yellow lines, which are the 7 and 14-day averages from long-term care facilities only. Next, we'll zoom in on the last 10 weeks or so. And you can see that we are finally starting to really come down from those holiday surges. It's great to see both our 7 and 14-day averages moving downward. We're still not down anywhere close to where we were before Halloween. So we still have a ways to go to make up some ground, but thankfully we're moving steadily in the right direction. And since it is the first briefing of the month, we'll move on to our age cohort chart. So we present this every month. As a reminder, the far left column shows the age cohorts. These are defined by the census. The next column shows the percent of our population in the county that particular age cohort represents. The next column, beginning with April 1st, shows the percent of cases within each of these cohorts and whether they have been increasing, which is red, or decreasing, which is green, compared with the prior month. You can see over time that the oldest individuals continue to be a smaller share of our cases and younger people a higher share. I want to note that we are seeing a small uptick in the 15 to 19-year-old age group and a continued decrease in the 20 to 24-year-old cohorts. But both of these age groups remain overrepresented relative to their share of the population. Also note that cases are continuing to increase in those 14 years of age and younger. Obviously these cohorts all have an impact on our schools. So I just want to continue to urge all of our families to be careful, both outside of school and inside of school. As I mentioned, we continue to have plenty of testing, and I want to urge anyone who wants or needs to be tested to get tested. We will be changing our testing hours starting next week. All of our sites will still be open Monday through Friday, but we're going back to half days at each site with varying hours each day. We're doing this because the volume of testing has gone down quite a bit, and we are going to shift some of that staff over to helping with vaccinations. We will be open this Saturday, February the 6th at the Pottstown site. We'll be open from 9 a.m. to 1 p.m. this Saturday, February the 6th in Pottstown. Registration for the Pottstown site Saturday will open online only at 7 p.m. Friday, February the 5th. And again, that is for Pottstown this Saturday, 9 to 1. In general, to register for a test, you can go online at montcopa.org/COVID-19. Click on the green County Testing Information button. Appointments online open at 7 a.m. on the day of testing for that day. Phone registration is also available for all the sites at 610-970-2937 for all the sites starting at 8:30 a.m. on the day of testing. And again, just a reminder, you cannot book ahead. So, sum this all up. We remain in a serious and continually evolving situation. Our cases are trending down, but we still averaged 225 cases a day for the last week and lost 22 lives. While we wait, hopefully patiently, for enough vaccine to arrive in our community to vaccinate everyone who would like to be vaccinated, we must continue to do the things that we know work, which are wearing a mask, washing our hands, and watching our distance. Those three things remain critical. We are far from out of the woods yet. I do have one announcement, which is that the county continues to hold virtual town halls on the COVID-19 vaccine. During these events, we partner with local healthcare and community leaders to share the latest information on prevention, vaccines, and answer your questions and concerns. On Tuesday, February the 16th at 7 p.m., we're hosting a COVID-19 vaccine town hall for the Latino community. We're really excited to partner with Aclamo, Telemundo 62, the Montgomery County Immunization Coalition, and the Pottstown Area Foundation for this event. This event is free and open to anyone who would like to attend. The program will be delivered in English and in Spanish. To register, visit our website at moncopa.org/town hall. And with that, I'll announce that our next virtual briefing will be Wednesday, February the 10th at 1:30, and I'll be happy to take any questions.
Our first reporter will be Maria Polsinella from WHYY.
Hi there. So I'm curious, if folks qualify for the 1A phase but are not residents or workers in the county, are they still able to register technically, even though it sounds like you discourage it based on the link sharing you mentioned?
Yeah, technically, we have been told by the Pennsylvania Department of Health that no county is supposed to turn away people who don't live or work in that county. So it is possible to register on our site, even if you don't live or work in the county.
So it's not something that you're technically able to enforce because of the PA DOH rule about turning people away?
That's correct.
Got it. Thank you.
Next, we'll go to Jim Melwart from KYW.
I'm confused by the link sharing. If I get a link and I sign up for an appointment and then I send that out to people, can they still sign up on that link?
They can. It is an unfortunate situation that the PrepMod software that we are required to use by the Pennsylvania Department of Health does not allow the creation of individual unique links. And so when we send out a link for a set of appointments, we send that link to the number of people that we have vaccine doses for. And if no one shared their link, it would work out okay. But unfortunately, people are sharing their links, and it is possible for other people, if they do it quickly enough, to jump in and make an appointment for themselves. So it's extremely frustrating to folks that are eligible and have been following all the rules and patiently waiting their turn to see others grab a link off of Facebook and make an appointment for themselves. And so I will ask again for people to stop doing that. It's not ethical. It's not moral. We're in a situation of extreme scarcity with this vaccine right now. That will get better going forward. But right now at this moment, it is extremely scarce. And people jumping the line just have no business doing that.
I'm sorry, I'm actually getting called on by the state at the same time. It timed out perfectly. The lower allocation, I apologize for that. The lower allocation, is there any indication for why it's lower? Is it weather related, or did you get any reasoning for that?
I'm not aware that we've been given any specific reasons. I am aware that during our weekly hospital call this morning, the hospitals all seem to have gotten less doses as well. And I've heard just snippets from some of our neighbors that everyone seemed to get less dose this week. So I'm not sure what's going on. We're awaiting further clarification from PADOH.
Is there any conversation with area hospitals or health systems to kind of combine efforts? You say you have the infrastructure at whether it's Norristown or wherever you are, Norristown High School. Is there conversation to kind of combine and bring all those together into one place?
Not that specifically, but we're working very collaboratively in lots of different ways. And so it's important that people understand that it's very difficult to transfer vaccine and almost impossible from one entity to another. So you have to get specific permission from PADOH. There's a lot of paperwork involved. So you can't just, pick up your vaccine and give it to somebody else. But we're working very collaboratively with all of our hospitals in the county. They've been wonderful partners. They have helped the county in vaccinating healthcare workers outside of their hospitals. They've helped the county in vaccinating first responders. Some are actually helping in some of our long-term care facilities that weren't otherwise getting assistance. And we're working collaboratively with one or two others to see if we can set up some joint clinics that would help move people off of our county registration list, but perhaps their staff and their vaccine to actually vaccinate those people. So we are working, all of us together, quite well, and we're using every idea that we can to vaccinate people as quickly as possible in our county.
Okay, I'll raise my hand again, but I'll let Todd move on here to other reporters.
Thanks, Jim. Next, we'll go to Carl Hessler from the Pottstown Mercury.
Afternoon, Commissioners. Have any additional cases of the UK variant been identified through the contact tracing program?
We have not received notice of any additional cases in Montgomery County of either the UK variant or any cases of the Brazilian or South American variant.
Okay. And on the link sharing, if somebody has inappropriately taken a link and scheduled an appointment for themselves, is there a way when they show up for that appointment to determine that they actually, for lack of a better word, stole that link from somebody else?
Well, what we are checking carefully is that they fit the eligibility criteria. So if they're there because they're a healthcare worker, they have to show proper identification. If they're there because they're over 65, they have to show proof of their age. And if they're there because they're under 65 but have one of those specific listed pre-existing conditions, we are asking them to sign an attestation statement attesting that they do indeed have one of those conditions. They don't have to identify the condition, but we ask them to sign a statement that they do have one of those conditions. And it would be we're trying to keep people moving through the site. And so it would actually be pretty time consuming to go through and check if every single name matched up on every single list. So it is possible to sneak in.
Okay. And can you elaborate a little bit more about the appointments you're going to eventually allow by people calling in? Is that a response to, have you gotten a lot of complaints from, for instance, senior citizens who have no access to the internet and can't make appointments or can't pre-register for vaccine? Is that a widespread problem in Montgomery County?
Well, we've known from the very beginning that we would need to set up the opportunity to register by telephone, just as we have the opportunity to register by telephone for our testing sites. And we've just had a lot happen quickly here in these last few weeks. And so it has taken us just these few weeks to get this up and running. But hopefully by the middle or end of next week, that option will be available. We have received certainly some information from individuals who weren't able to register online for a variety of reasons. And we have been doing our best to assist them, but we really need to create a whole infrastructure around that. And that's what we've been working on. And hopefully that's going to be able to go live next week.
Okay, and then those that would pre-register by phone, they would be contacted by phone when vaccine would be available for them.
That's correct. So that's what's made this much more complicated than the testing phone registration. You know, when you register for a test, that's it. And then you go get your test. So with this, people are going to be pre-registered and they will be put in the line, just like anybody else who registered online at the same time. And so they'll be waiting in line. And as we've discussed, they could be waiting in line for a period of many weeks. And then once we get to them in the line, then they will need a phone call back in order to actually schedule their appointment. And when the scheduling of the appointment is done, there's additional personal information that has to be inputted into the system. Some, more information about demographics, where you live, just some other things like that. And so all of that does take some time. So building this is a much more complicated task than it was to build the phone lines for our testing sites. But we're very pleased to be able to offer this to anyone who doesn't have either internet access or a working email address. So we're anxious to get this up, and hopefully that will be the case by the end of next week.
And at that time, you'll have the phone number available. You'll publicize the phone number that people should call and the exact date when that's going to kick off.
Yep. As soon as we have it firmed up, we will absolutely get that out there.
Okay. Thank you. That's all I had today. Thank you very much.
Thank you.
Next, we'll go to Deanna Durante from NBC 10.
Hello. On the schools front, is there any discussion about changes in the recommended spacing between students as other counties and some districts start to look at 3 feet instead of 6 feet in order to get more children into classrooms?
Yeah. That question comes up a lot. We continue to follow the PADOH and Pennsylvania Department of Education guidelines and the CDC guidelines, all of which say 6 feet where feasible. And that is what we share with our school districts. There are places who have gone to a shorter distance than that, a tighter distance than that. If a student does test positive, and there are other students within 6 feet of that student, then all of those students have to quarantine. If the student tests positive and the other students are at least 6 feet away, then the only person that has to quarantine is the student that tested positive. So these are some of the trade-offs that schools are wrestling with. We have also seen linked transmission. Now, I don't want to overstate this. It's been, I think, four cases recently that of linked transmission in schools, and in all those cases, the social distancing was less than the 6 feet. So, this is a decision at the local level that schools need to make. Some schools are willing to have more students go into quarantine. Other schools are not willing to take that risk. So it really is coming down to a local decision at this point.
So that brings me to my next question. Are you seeing, since you tried to dedicate the resources towards schools in contact tracing, are you seeing more or less cases? If you look at a district that's adhering strictly to that 6 feet, are they faring better than some of the other schools that may be using 3 feet or an all in-person model? Or is that just too much to keep track of right now?
I don't have that information. We can certainly ask our staff if they have that, but I don't have that answer.
And then when it comes to getting teachers vaccinated, some parents have asked me if it would be mandatory for teachers to be vaccinated. Is that something that the county could impose or is looked at or discussed, or would that be up to districts, or is that even not something that would be done?
Well, it's not something that the county could impose. I believe that it might be possible for a school district to require that, but I am not certain. Each district would really need to check with their solicitor.
What about Montgomery County on its employees that are dealing with vulnerable populations? Would you mandate that?
We currently do not have plans to mandate that anyone be vaccinated.
Okay, thank you.
Mm-hmm.
Our next reporter will be Justine McDaniel from the Philadelphia Inquirer.
Hi, Commissioner. You mentioned a couple of these obstacles with the PrepMod scheduling software that's coming from the state, and you guys don't have control over using that. I'm just curious if there are any other similar constraining infrastructure or technological factors that are kind of hindering the rollout that are similar to that.
Not for us. We have one constraint here in Montgomery County, and that's that we don't have enough vaccine. We have plenty of people to give it. We've got the infrastructure built. We're so ready, but we don't have vaccine. So other than that particular situation with PrepMod, we're doing well. We're doing well. And getting these phone, getting that phone registration set up. I don't want to minimize the importance of that either. But other than that, we're in good shape. We just need
Okay.
vaccine.
Okay. And how is the county doing with tracking racial equity in the vaccine distribution? A lot of places are having trouble getting complete data on who is being vaccinated. How is the county doing on that?
Yeah, so that's one of the pieces of information that is inputted into PrepMod when you make your actual appointment. And there is an option for a person to tick that they do not wish to respond. What I have not yet seen is output from PrepMod that we're hoping that we'll be able to get reports on that so that we can track this. But so far, we have not seen any reports.
Okay, that's all. Thank you.
Thank you.
We'll open it up to our reporters for a second round of questions. We'll start with Jim Melwart, as he already indicated he had some. But for the other reporters on the line, if you do have follow-ups, please let us know by raising your hand, letting us know in the chat, or by taking yourself off of mute. Thank you.
I know you've been asked this several times already, but I really just want to drive this home because it confuses me. As far as someone, so I didn't sign up where I signed up recently with the county, but I got a link and now I have an appointment. Is there any way that you could check IDs when people come in to say this is the person who registered, or is there any way to prevent that line jumping? And what do you say to someone who signed up weeks ago and still hasn't heard back and now sees their neighbor go and get a shot?
Yeah. Well, it's really frustrating. It is not an easy thing to do to check those IDs, particularly right now, because we're still vaccinating healthcare folks. And what happens in that particular circumstance is that a doctor's office registers that their office needs to be vaccinated. And that office might have 12 or 15 people in it. Let's say they have 15 people in it. And so we basically account for 15 slots from that office when we send out our appointment links. But we don't know the names of those 15 people until they actually register for a vaccination. And so if one of those 15 people decides to share it with a family member or a friend, we don't have a master list of those names to check to make sure that that other person should actually be on the list. But what we do is they have to fit into one of the eligibility categories. And so if they don't fit into one of the eligibility categories and can't prove that they are, then we do send them away. It is an imperfect system, but it is with the way the software works, it's really the best that we can do without making the lines at the vaccination sites themselves move incredibly slowly.
In that incredibly embarrassing moment where I got called on by the state and by you, I asked the state just now if this is a known problem with their scheduling software, and they said they don't have central scheduling software. Are you using this for something that it's not really designed for, and is there a better solution on your end?
Well, I think they were answering a different question than the one that you asked. So PrepMod is the software that the state has given to all the counties. We're all using it. Several of our hospitals are using it now. We're using it because it automatically uploads all the data of who has been vaccinated to the Pennsylvania CIS database, which is the vaccine immunization surveillance site that we're required to report to. And so you have to put all the data into PrepMod in order for it to have the data to upload to the state. And PrepMod was what we were given to register people for their appointments. But the state is not doing it, right? The state does not have a centralized system, and the state isn't giving vaccine themselves. So they may not quite have understood the question you were asking. There are calls twice a week that my staff participates on with the PrepMod folks, and I think somebody from the state, where folks from our county and every other county, from what I can tell, conveys these challenges with the PrepMod software to the PrepMod team and asks for resolution. And so far that has not been coming.
And did anyone ask, and have you answered already? And if you did, skip it. What you say to people who are jumping that line?
Well, if we know they jumped their line, they have to, they show up and we figure out that they shouldn't be there, they're asked to leave. So they have to just go home. But big picture, we are in an extremely, extremely scarce vaccine situation. And we have to pull together as a community and get the most vulnerable people in our community vaccinated first. So I just am asking people to be honest and not jump the line. If you didn't get the link from the county, then you shouldn't have the link. So please don't try to register for an appointment through it.
But we're saying if your card gets pulled, by all means get the vaccine. But in this case, if I'm 65 or old, if I qualify in 1A and somebody sends me the link and I sign up, am I doing anything wrong?
Well, you're jumping the line. So you'll have to decide yourself if that's okay.
And what do you say to that person?
I don't think it's okay. I think the people that have been patiently waiting in line need to wait their turn.
I'm good, thanks.
Next, we'll go back to Justine McDaniel from the Philadelphia Inquirer.
Let me follow up really quickly on what you said about this call that you have with the prep mod folks. Is that just people in Pennsylvania, or is that like across the country counties are using this? Do you know?
I don't actually know. I'm not on those calls. My staff are on that call, but we could certainly get you that information if you're interested.
Okay. And then I was just wondering if you've had any reports anywhere in the county of people having trouble getting their second doses, missing their second doses or anything like that, or if you're aware whether, everyone's gotten them on time.
Yeah. So the only problems that I've heard about were people who got their first doses in another state or got their first doses very early on from some pharmacies who should not have given them first doses because they were not healthcare providers. And so I know there's been some issues there. I think there's been a handful of people, although not too many, that are actually Montgomery County residents that got their first doses from Philly fighting COVID. So I know that's been a little challenging for some people. But by and large, if you got your first dose from the county or from one of our hospitals in the county, that's been going very well, and people are getting their second doses.
Okay, great. Thank you.
Thanks, Justine. We haven't received any further indications from any other reporters, so that concludes our questions for today. Great. Thanks, everybody, and we'll see you next week.
Can I ask one more question quick before we go?
Okay, Jim.
Not to ruin your big goodbye. My understanding is Pennsylvania is holding back physical doses for second shots. Do you have concerns about that? Do you think that's necessary? Do you have any thoughts on that? Would you prefer to see those shots coming out as first doses?
Well, first of all, I can't confirm that that's the case. I don't know whether or not that is an accurate statement that they're holding back second doses. However, on the question of whether or not we should be giving people their second doses, everything that I have seen from the real experts on this, I would refer you to a recent, just a short public clip that Dr. Paul Offit made on this very topic about the importance of getting that second vaccine. We just don't know how long you can wait between the first dose and the second dose and still have the high degree of effectiveness that we've seen when people get both of their doses. The CDC has looked at enough data that they're comfortable saying you could go 6 weeks rather than the 3 to 4 weeks that are currently the sort of considered the standard time. But beyond that, there's just not a lot of data. And so they're really, there's nobody at CDC, Dr. Offit, people like that, they're not recommending that we do a first dose only strategy with an uncertain time to receiving that second dose. The first doses are absolutely helpful, but they're not nearly as good as 2 doses in terms of preventing serious cases of COVID. So we really want to get that second dose into everybody.
Right. And to be clear, in their briefing right now, the Department of Health said they are holding back second doses,
Okay.
physical
Yeah.
on hand second doses. Do you think that the state should be doing it on the receiving end, or do you have any confidence, I guess, that supply would dictate to get all those first shots out, don't hold back second doses, or are we in a place now where it's so questionable that you may need the state at the receiving end would need to hold those second shots, understanding the importance of the second shot?
Right. So based on what we've seen last week and this week, it seems that the supply of first doses is really dwindling for reasons that are not clear to me. And so because of that, I would support that the state hold back the second doses so that we can at least make sure that we fully vaccinate those that have already started the process.
Great. Thanks so much. I'll mute and I won't come back on, I promise.
Okay. All right. I think that's it then. Thank you, everybody. We'll see you next week.
Thank you.